Vital Signs, Chapter 9. Vital Signs. Vital Signs, Chapter 9. Vital Signs. The most important measurements obtained when assessing a client's condition. Temperature, pulse, respirations, blood pressure. Vital signs. Drastic changes of these signs can lead to death. These signs are vital to life. Thus the terms vital signs. Vital signs, good indicator of body's ability to maintain homeostasis. May affect vital signs, age, activity, nutrition, emotions, fitness, meds, illness. Fifth vital sign, pain. Rating pain on a scale of 1 to 0, 1 equals 1 minute to 10 equals severe. Other signs, skin color, pupil size, reaction to light, lock, response to stimuli. Body temperature, defined. Vital signs, Chapter 9. Body temperature, defined. Measurement of the balance between heat lost and heat produced in the body. The measurement of core body heat. Temperature. The first assessment taken. Vital signs, Chapter 9. Temperature. The first assessment taken. Normal adult temp, 98.6 degrees Fahrenheit, 37 degrees Celsius. Normal range, 96.8 degrees Fahrenheit to 100.4 degrees Fahrenheit, 36.0 degrees 38.0 degrees Celsius. Variations may be due to time of day, allergic reaction, illness/infection, stress, exposure to heat or cold. Variations, time of day, temps usually lower in the morning/higher in the evening. Exposure to heat or cold, higher out in sun, lower when exposed to cold air. Formula conversion F to C to F. Fahrenheit to Celsius. Degree Fahrenheit, 32 divided by 1.8 equals degree Celsius. Celsius to Fahrenheit. Degree Celsius x 1.8 plus 32 equals degree Fahrenheit. Temperature. High temps above 100.4 degrees Fahrenheit, 38.0 degrees Celsius. Hypothermia. Hypothermia. Vital signs, Chapter 9. Temperature. High temps above 100.4 degrees Fahrenheit, 38.0 degrees Celsius. Documented as febrile, fever. Normal temperature range, a febrile. Hypothermia. Temperatures above 104 degrees Fahrenheit. Death and convulsions. Hypothermia. Temperatures below 95 degrees Fahrenheit. Death. Pyrexia, aka fever caused by an infection or injury. Death occurs if body temp drops below 93 degrees Fahrenheit. Fever equals body temp, 101 degrees Fahrenheit rectally. Temperature sites. Oral, tympanic, rectal, most accurate, axillary. Vital signs, Chapter 9. Temperature sites. Oral. Normal, 98.6 degrees Fahrenheit. Range, 97.6 to 99.6 degrees Fahrenheit. Axillary. Normal, 97.6 degrees Fahrenheit. Range, 96.6 to 98.6 degrees Fahrenheit. Tympanic. Rectal, most accurate. Normal, 99.6 degrees Fahrenheit. Range, 98.6 to 100.6 degrees Fahrenheit. Oral, in the mouth/under the tongue, most common, convenient and comfortable. 3 to 5 minutes. Mercury thermometers are read by degrees, and 0.2 of a degree. Axillary, in the armpit, aka axilla, abbreviated equals ax, charting. 10 minutes, remove clothing. Hold thermometer in place. Tympanic, in the ear canal, oral, abbreviated equals T, charting. Rectal, through the anus/rectum, internal and most accurate abbreviated equals R, charting. 3 to 5 minutes, always hold thermometer in place while taking temp. Use a lubricant with rectal temps. Thermometer types 2 basic types dash. Vital signs, Chapter 9. Thermometer types. 2 basic types dash. Electronics/digital, measures temperature through a probe. Glass, contain mercury in the bulb. Rounded tip, rectal use. Long tip, oral use. Security tip, both oral and rectal assessments. Electronic, make sure probe is as close as possible to area where you wish to measure the temperature. Disposable plastic covers, prevent contamination. Glass, maybe colored red, rectal, blue, oral and axillary. aka clinical thermometer. Pulse auscultation, listening for sounds. Vital signs, Chapter 9. Pulse. A wave of blood flow created by contractions of the heart. The amount of blood pumped from the left ventricle of the heart to the artery being assessed. Pulse is checked by palpating, to feel. Or auscultation, listening for sounds. Contractions of the heart equals heartbeats. Vital signs, Chapter 9. Pulse sites, points. Named according to bones or other structures near where they are located. Most common sites. Radial, inside of wrist. Brachial dash. Adults, antecubital space, bend of the elbow. Children, middle of the inside of upper arm. Apical, auscultated with a stethoscope placed on the chest wall. Apical pulse, often used when assessing infants and young children. Adults, must be taken before certain drugs, may slow heart rate. Used when an apical radial pulse deficit is being assessed. This occurs when there is a difference in the rate of the radial and apical pulse. Apical pulse, higher, indicating the heartbeats are not reaching the radial artery. Obstruction, trauma, abnormal heartbeat or other disorder may cause the deficit. Taken, BC illness, atherosclerosis, weak/rapid radial pulse, doctor's orders. Vital signs, Chapter 9. Pulse sites, points. Named according to bones or other structures near where they are located. Other sites. Carotid, alongside the trachea toward the ear. Temporal, front edge of ears. Femoral, in the groin or crease between thigh and abdomen. Popliteal, behind the knee, toward the midline. Dorsalis pedis, dorsal side of the foot. Posterior tibial, behind the medial malleolus. Carotid, on PT/client not having a heartbeat during CPR, found more often when pulse is weak or BP is low. Temporal, pressure here could slow bleeding from the scalp. Femoral, most commonly used for invasive procedures, used as a site to slow bleeding in the leg. Popliteal, used for assessing BP in the leg. Dorsalis pedis and posterior tibial, used during neurovascular checks of the feet to verify circulation. Pulse characteristics. Vital signs, Chapter 9. Pulse characteristics. Pulse assessment characteristics include rate, BPM. Tachycardia, pulse rate faster than 100 BPM. Bradycardia, pulse rate slower than 60 BPM. Normal ranges. Infants, 100 to 160 BPM. Children, 1 to 7 years, 80–110 bpm. Children 7 years, 70 to 90 bpm. Adults 60 to 90 bpm. Rate, beats per minute, bpm, count for 15, 20, 30, 60 seconds. Tachycardia, causes, physical/mental stress, infection, pain, exercise. Bradycardia, causes, physically fit athletes, taking meds for the heart. A severe lack of oxygen or BP. Normal range varies with age and gender. Adult men, 60 to 70 bpm. Adult women, 65 to 80 bpm. Age pulse rate. Physically fit, pulse is on low side. Pulse characteristics. Vital signs, Chapter 9. Pulse characteristics. Pulse assessment characteristics include rhythm, pattern of heartbeats, regularity, regular or irregular, arrhythmia or dysrhythmia, irregular heartbeat, must be counted for a full minute. Medications, heart dysfunction, lack of oxygen. Pulse characteristics. Vital signs, Chapter 9. Pulse characteristics. Pulse assessment characteristics include volume, the strength of the pulse, measurement as it presses against the arterial wall and against your fingertips when palpating. Rating scale. 0, absent, unable to detect. 1, thready or weak, difficult to palpate, easily obliterated by light pressure from fingertips. 2, strong or normal, easily found and obliterated by strong pressure from fingertips. 3, bounding or full, difficult to obliterate with fingertips. Volume equals strength, intensity. Thready or weak pulse, may indicate decreased circulation, obstruction of the artery, weak contraction of the heart, low blood pressure. Bounding pulse, may indicate high blood pressure or strong contractions of the heart. What affects pulse rate and quality? Body temp, emotions, activity level, health of the heart. Pulse characteristics. Vital signs, Chapter 9. Pulse characteristics. Pulse assessment characteristics include bilateral presence, found on both sides of the body, having the same rate, rhythm, and volume. Unilateral, found on one side of the body. Vital signs, Chapter 9. Respirations. The act of breathing, the exchange of oxygen and carbon dioxide from the air into the lungs. Breathing in, inspiration, and breathing out, expiration. Assessment. Rate. Rhythm. Quality. Respiratory rate. Observing the client's chest movement for 1 minute. Quality, character, depth and quality of respirations. Deep, shallow, labored, difficult. Vital signs, Chapter 9. Respirations. Respiratory rate, the number of breaths per minute, counted for 1 full minute. Suggested normal rate, 12 to 20 breaths/minute. Ventilation, movement of air in and out of lungs. Hyperventilation, increased respiratory rate. Hypoventilation, decreased respiration rate. Rates decrease with an increase in size and age. Hyperventilation causes physical/mental stress, infection, exercise, anxiety. Increase in body temp. Lack of oxygen or low blood pressure. Hypoventilation causes pain medications and alcohol. Decrease in body temp. Severe lack of oxygen and no blood pressure. Children, respiration slightly faster than adults 16 to 25 bpm, AVE. Infants, 30 to 50 bpm. Respirations, respiratory rhythm, abnormal respiration, Cheney-Stokes. Vital signs, Chapter 9. Respirations. Respiratory rhythm should be regular. Abnormal respiration, Cheney-Stokes. Periods of dyspnea followed by periods of apnea. Apnea, no breathing. Respirations, quality of respiration is seen in volume and effort. Vital signs, Chapter 9. Respirations. Quality of respiration is seen in volume and effort. Volume, the amount of air taken into the lungs and exhaled from the lungs. Documented as shallow or deep. Effort, the amount of work the client uses in order to breath. Muscle use seen in the neck, chest and abdomen is an indication of labored or difficult breathing. Dyspnea, difficult or labored breathing. Tachypnea, respirations over 25 per minute. Bradypnea, slow respirations, 10. Orthopnea, severe dyspnea, breathing is difficult in any position other than sitting erect or standing. Rales, bubbling or noisy sounds, fluids/mucus in air passages. Wheezing, difficult breathing with high-pitched whistling or sighing. Cyanosis, bluish discoloration of skin, lips and/or nail bed. Vital signs, Chapter 9. Measuring methods. If using a mercury thermometer, measure the pulse and respiration while waiting for the temperature. If using another method of measuring the temperature, complete the temperature, then measure the pulse and respiration. Keep your fingers on the pulse while measuring the respiration. Chart in this order: temperature, pulse, respiration. Vital signs, Chapter 9. Blood pressure. Blood pressure, the amount of pressure or tension exerted on the arterial walls as blood pulsates through them. Systolic pressure, the pressure exerted on the arteries during the contraction phase of the heartbeat. Diastolic pressure, the resting pressure on the arteries as the heart relaxes between contractions. Measured in millimeters of mercury, Hg. Systolic pressure should be higher because pressure should be higher in the blood vessels when the heart is contracting. Factors that may affect blood pressure: lying down, usually lower BP. Sitting position. Standing position, usually higher BP. Increase in blood pressure. Excitement, anxiety, nervous tension. Stimulant drugs. Exercise and eating. Decrease in blood pressure. Rest and sleep. Depressant drugs. Excessive loss of blood. Blood pressure: normal systolic readings, normal diastolic readings. Vital signs, Chapter 9. Blood pressure. Normal systolic readings between 100 to 140 mm Hg. Normal diastolic readings between 60 to 90 mm Hg. Prehypertension readings. Systolic, 120 to 139 mm Hg. Diastolic, 80 to 89 mm Hg. Hypotension, lower than normal BP, body attempts to raise the BP-. See signs of shock or a lack of blood flow to the body's tissues. Signs of shock: change in level of consciousness, LOC. Increased heart rate and respiration. Weak, thready pulse. Pale, sweaty skin. Blood pressure readings. Vital signs, Chapter 9. Blood pressure readings. American Heart Association recommendations. Patient should sit quietly for at least 5 minutes before the BP is taken. 2 separate readings should be taken and averaged. Minimum wait of 30 seconds between readings. Follow these recommendations for an accurate reading. Proper cuff size: SB the same diameter as the arm. Small cuffs result in falsely high readings. Large cuff may cause falsely low readings. Blood pressure sights. Blood pressure can be obtained from any artery. Vital signs, Chapter 9. Blood pressure sights. Blood pressure can be obtained from any artery. Need a pulse sight. Safest and most convenient sights. Brachial, most common for routine versus for adults/children. Radial, possible sight for infants or clients with very large upper arms. Popliteal/femoral, behind the knee/thigh, used because of trauma, disease, medical treatments to the arm, or recent mastectomy. Dorsalis pedis/posterior tibial, lower leg, common use for infants. Blood pressure equipment. Vital signs, Chapter 9. Blood pressure equipment. Sphygmomanometer, the instrument used to measure BP. Sphygmo, pulse. Mano, pressure. Meter, measure. Commonly referred to as the BP cuff. Types of sphygmomanometers. Mercury. Aneroid. Electronic, no stethoscope needed. Vital signs procedures. Vital signs, Chapter 9. Vital signs procedures. Perform the least invasive first. Invasive, invading someone's personal space or inserting a needle into the skin. Non-invasive, actions that do not intrude, a simple observation. Temperature. Pulse. Respiration. Blood pressure. Temperature and pulse and respiration are commonly taken at the same time.